change is real, and don't be afraid of change.
Absolutely. And I think we set ourselves up for a lot of unhappiness and anxiety and distress when we assume that things are going to carry on as they are forever. Hello, everybody. This is Dr. John Chuback, the host of the Business of Better podcast, where we speak with healthcare professionals, physicians, and everyone related to the healthcare field who have interests in entrepreneurship and business. And today's guest is Dr. Tracy Kimball. Dr. Kimball is a board certified vascular surgeon, and she has a tremendous background and training. She also has a great interest in business. She also has an MBA, which she recently got. She did her training at the University of Colorado and the University of Utah, two very, very fine institutions to be sure. And Tracy has gone on to build a company called the Wish Clinic. And that's one of the many things I want to talk to her about today and learn more about. So, Dr. Tracy Kimball, welcome to the Business of Better.
Thank you, Dr. Chuback, and thank you, Business of Better, for having me today. I'm excited to share my journey.
Great. It's a pleasure having you. Speaking of your journey, why don't you begin, if you would be so kind? I touched on it, but give us a little bit of your educational background. I think beginning back at the University of Texas, if I'm not mistaken.
Yes, that is correct. I actually stayed in Texas and went to undergraduate and got my bachelor's of science in zoology, which is essentially where the training wheels went on to prepare me for a career in medicine. I decided that I would actually do a bachelor's of science in zoology because the upper level classes were mostly, or I could choose and dovetail pre-med classes with the bachelor's. And so I could get additional credit and graduate in 4 years with the bachelor's of science pre-med and get prepared and prepare myself to go to medical school, which I did at the University of Texas in San Antonio. And that was 2004 when I finished med school. And then that brought me to general surgery training at the University of Colorado here in Aurora, Colorado. And I did a 7-year general surgery residency with an emphasis on vascular surgery and vascular medicine. My mentors coached me into that career path. There were maybe some dips and turns possibly of being a breast surgeon or maybe even being a transplant surgeon, but ultimately vascular medicine was what really did it for me. And I went to the University of Utah in 2011 to start that fellowship with the folks at the University of Utah. So, and actually, ended up having a 7-year general surgery residency because I decided to be one of the few women in the surgical training program to decide to have a family in the middle of my training. And so in the midst of my 3rd and 4th year of general surgery training, I had 2 children. And during that time off, I actually was focused on clinical vascular research. And so I worked for a CRO in town called Colorado Prevention Center under the guidance and leadership of Bill Hyatt, who was at the time the scientific advisory committee chair of the FDA. So I actually got to cut my teeth in a little bit of research in clinical medicine and clinical research during that 2 years, started my family and brought my family to the fellowship at Utah, and ended up realizing that there was a lot of hats to wear while I was in the midst of training. So I actually completed that year and did further additional clinical vascular research during that first year, and actually decided to move the family back from Utah and get started in a general surgery career, and actually didn't complete the fellowship completely. And that's when I was introduced to the world of wounds. And so we moved back to Denver And I started working for a management services organization that was opening a market in Denver, Colorado for post acute skilled bedside wound management. And all of my former experiences from college through medical school, training at the University of San Antonio, learning about vascular medicine there with all of the named mentors at the University of San Antonio. That's where KCI obviously started the wound vac and learned about all of that. And it just brought it full circle, going through training in general surgery and then vascular surgery to then start in wound management and help start a market for that type of care in skilled facilities in 2012. And so that's when I started in wound care. I started to obviously learn about the business side of medicine, and because I was starting with a startup organization. And at about 3 years in, I was offered a position to do locums and start learning more about the practice of wound management across the continuum of care in a locums medical director role. And so I started doing some travels, and I was working in hospital outpatient departments, and then ultimately landed my family back in Denver, where I was offered a position to work for an organization called Innovage PACE, which was a program of all-inclusive care for the elderly. It was a ACO-like um, uh, economic model or care model here in Colorado, and I was onboarded to be their director of wound care services and help them internalize a lot of their wound care protocols and SOPs, and that's really sort of when I really started to understand and have the genesis of this penchant to want to run and operate a clinical practice, because I was given that role and that charter as the director of those services inside that organization. And so I actually started seeing patients inside of Innovage and worked for Innovage for 7 years. And helped them establish a care model around all inclusive care for wounded patients or skin injured patients, and of course did the MBA during the last 3 years of that tenureship with PACE. I went back to school at the University of Denver, Daniels College of Business, and got my MBA in healthcare executive leadership. And then at the end of that, graduated, and shortly thereafter transitioned and hired a management services group, a mobile group, to come in and take over the Denver market and the Denver services, and then propagate that across all markets in the Innovage system, across all the states that they're operating in now. And so that organization is executing, operationalizing the pilot that we started in Colorado for wound care management services inside of PACE. And then I started Wish Clinic shortly thereafter in November of 2023. And it's an place of service 11, all inclusive type model that we're building, adding service lines for both medical services around skin injury, acute and chronic skin challenges, inclusive of the DMEs that was required to the ancillary adjunctive therapies that go into helping patients heal. We have a DME service line that we have established. We have clinicians taking care of acute and chronic skin disorders, mostly focused on chronic wound management and servicing both large primary care organizations in the community, as well as individual hospital systems that are discharging patients that don't typically have that doesn't have an in-house outpatient department for those patients to be seen. And so we've essentially become a tertiary referral center for whole person care in the Denver suburbs of Aurora, Colorado.
Wow. Amazing, amazing journey and career, and congratulations to you. I apologize if I misspoke describing you as a board certified vascular surgeon, but I recall now in previous conversations you and I had that you elected not to complete that program, but certainly all of your training came in handy with the
It did.
amazing work that you do. Tell us about the Wish Clinic. Is it an acronym? Why is it called the Wish Clinic?
Yeah, so it's an WISH actually stands for many things, but the tagline is working in synergy for humanity. And essentially, the premise of the clinic was this idea that we could offer a consortium of services and products that would be able to basically help assist the patient down the care journey and navigate their logistics of chronic wound care and wound management. So, and all these things synergistically coming together to provide the assistance that patients need to heal. Um, I would say that of the ethos that the human body is programmed to heal itself, and that the barriers of healing get in the way of healing. And it's our job as clinician and ancillary care specialists, as well as behavioral changes as a part of the care plan, are there to assist with the removal of those barriers or the reversal of those barriers of healing so that the body can ultimately heal itself as it's programmed.
Absolutely fantastic. I often think, in a very basic sense, for some of our listeners who may be more business oriented and less medicine oriented, where I think that makes the most sense is with a broken bone. I always think of of course, now there are more advanced techniques, but the old time orthopedic surgeon who would simply reduce a fracture and stabilize the fracture, immobilize it with a cast, for example, and then give the body a chance to do what it does best, which is to heal that fracture. And I know that's so much of what you do. Well, I think your story is obviously perfect for the Business of Better podcast, and you're a great inspiration, I would think, to everybody. But I'll go out on a limb and say you're really probably an extra special inspiration to so many women and young women and girls out there who aspire to do something quite extraordinary with their life, because you have certainly done that with a background in science, what we now call the STEM kind of education, and then a medical degree, surgical degree, vascular surgical training, and then to go on to an MBA, something my wife also did after her vascular, after her neurochemistry PhD. I think that it's really quite remarkable what you've done and what you've achieved, and then to use all of those skills rolled into one cohesive, logical focus that has culminated in the Wish Clinic. And I find it inspirational. What is it about
Thank you.
business that draws you to it?
Well, I have to say, there's definitely something about genetics. So, I would say I was genetically programmed to be here and purposed from the jump. My mother and family my mother specifically was healthcare administrator, and actually worked for Tulane Medical Center as the director of the outpatient office then, in registration, from my genesis. My father actually was an auto body mechanic, and so I guess that's where the penchant and the draw to becoming a surgeon was, because he was always tinkering on things when we were together growing up. He loved model trains, and building model airplanes, and so and I was his only. When he was married to my mother, so I mean, I was maybe the son he never had, but I ultimately was all of it for him, and so we did a lot of tinkering when I was a kid, and I think that's where I get the engineering and the tangible need to use my hands to fix things from him. So I say genetically programmed to become a surgeon, but also an operator, and an entrepreneur, because it's part of my family genetics. we're from Italy, from Sicily, and I've done a lot of history on my genome and my in my genealogy, and we come from a patriarchal but maternal family of entrepreneurs and conquistadors. So it's just all there inside my genome, and I've really just leveraging all of those things and that generational history that you said culminated to the Wish Clinic. And been very lucky, and just almost many times lucky and serendipity colliding to put people in front of me that have been wonderful mentors to coach me through all of this, because I do believe I finally found my purpose, even in that little bit of a circuitous way, because I didn't go straight into the fellowship and complete that. We had to be mindful that there were life changes and life cycle events that needed to happen and did. And that's my beautiful two children, Spencer and Alexa, that had me stepping away from formal fellowship training and a specialty that clearly is needed, vascular health. But yeah, and I just then parlayed all of that experience into wound care and wound management, and now I get to, in my venue, which is behind me here, this is my office, my center, I get to still do procedures, and I get to still be a surgeon in so many ways, even though it's not the operative theater. And now we get to bring in the research. So we're not just a outpatient private office doing, medicinal wound care. We're doing interventional wound care at the Wish Clinic, and we're offering opportunities for patients to get access to pre-commercial products in an investigational research forum. And so I've taken that experience that I had with the Colorado Prevention Center as a research intern or fellow, and I'm using those skills in that experience to actually start a new, become a principal investigator for some industry sponsored clinical research trials. So we're actually an enrollment site for patients to enroll and get access to these novel therapies that are coming down the pike in the wound care industry.
Oh, that's amazing. We have a lot in common, more than I thought.
Yes.
My grandfather and my uncle were in the auto body business for many years, two generations
Wow.
of
Yeah, that's
German
cool.
Americans banging out fenders and doing a lot of sanding and painting and all of that. It's a wonder the two of us didn't become orthopedic surgeons, but
Well,
I've
I
al-
had considered that at one
same
point, to be honest.
same here.
I
I probably wasn't smart enough. I probably made a poor choice, but
That's exactly what I
vascular
say.
vascular and cardiovascular have been very rewarding. But in addition, we have an interest and a love for entrepreneurship, and I think one of the things that we oh, I think maybe your recording has stopped. Let's see.
I think we're here. Are you here? I think can you hear me?
Yeah, I hear you now.
Okay, cool.
Good. I'll just pick up where we left off. That'll be
Yeah,
all
no,
good.
it was consuming bandwidth because I had a phone call that came in. I think
Oh,
it
I see.
consumed a
Okay.
little bandwidth there. So,
I got you. Okay. So, uh, as I was saying, we both have an interest in entrepreneurship, and we've worked together in the past through my company, VitaSupport MD, and the micronized purified flavonoid fraction, which fits right into the world of what you're doing with wound healing and venous ulcer. And of course, my dear friend and colleague, Monica Glavitsky, very well, who did so much of that research years ago. But I think for me, one of the things that was so compelling about entrepreneurship and what I see you doing, even extended into the research you're involved in, is that as a surgeon, it's a wonderful feeling to be able to use your hands and your mind and your heart to impact the lives of an individual or the life of an individual. And over the course of a long career, hundreds and then thousands of individuals. But through entrepreneurship and building centers like yours and getting involved in research and offering either medications or supplements or devices, then you really have an opportunity to impact possibly tens of thousands, hundreds of thousands, and even millions of people in the United States and around the world. Your thoughts on that?
Yeah, I think it takes it all the way down to the logo of the organization. It was a global mission from the jump. I was always, as the only child of two working class Americans, one being in healthcare and one being in fixing cars. Um, I was always encouraged to think big. And so in 2014, when the idea came into my mind, simply because I have a story. I mean, I was at the precipice of a lifestyle change, a career change. I wasn't sure if I was even going to ever step foot in an OR again. Going into the bedside, to the bedside for wound management. I mean, I don't had it lost the eligibility to even sit for my general surgical boards. I really didn't know what I was going to do. And the genesis of the Wish Clinic came to me, and I said, well, you are good with your hands, you have a heart, you have compassionate, you've been working next to elders and healing skin, and you're really good at it. Why not hang a shingle? And and the climate, or the insurance climate, allowed me to create an organization, in national provider identifier, and I simply just did that, and then said, okay, well, I will network with payers and start taking care of patients with wounds organizationally. And then that just evolved into the Innovate thing, and then ultimately that allowed me to really understand organizational leadership and a little bit, obviously, entrepreneurship, because I had charter and I had governance to build an entire service line for internal wound care and wound management services that was nurse driven. So and then so the MBA just naturally happened because I needed to have, I think, the credential to be able to sit outside of an organization that was already structured, because I would be leaving, I would be sunsetted and leave the organization. And that's when I, knew that I could open up practice, and I had all the credentials. I had the foundation to do that operationally. And like I said, it was a global mission, because why stop with just one site? And if we could validate it and create the minimally viable product. And of course, I learned all these things during my MBA, and then of course pitching and going to competitions and Shark Tank stuff and all of that. I'm learning what it takes to actually create scale and make something that touches hundreds and thousands, if not millions. And so that's the vision. That ultimately was um, where I could see that possibly. And of course, now it's all about looking for strategic partners. And because a single physician, even a surgeon, I don't think can bootstrap that kind of thing. But yeah, and that's why we developed the product line and the other verticals in the enterprise to actually help generate some additional capital, so we could scale and grow and touch more lives. And that's essentially what I decided when leaving Innovage, was that I simply wanted to touch as many people as I could.
Fantastic. It sounds like you're using nurses to help expand your two hands to many more hands. How has that process been for you?
Well, it's great. I mean, I think there is so much work to be done. We absolutely have to be able to replicate our hands. And something that I learned in working at Innovage and Pace was that it was about elevating professionals to operate at the top of their license. And so that kind of starts to turn on the educator hat, because I think, a skilled operator or proceduralist can definitely contribute to the education of elevating nurses to the top of their license, because they're not going to get that skilled training inside their RN or their PN, education, other than what's experientially sent. It's all just experiential or expeditiary at that point, because it's not built into the curriculums as hard, as hard topics. So that's where InnovAge really was a benefit to me, because I could actually see and execute that nurses could be scoped and talented and skilled, hard with the hard skills to do the work that's needed to be done to propagate and, I guess, scale the hands of a proceduralist in the space of wound management and wound surgery. And just thinking logistically, I mean, a lot of what we do is logistics, and so educating the nurses to take a more thought leadership approach to their practice, that was a benefit, in my former, under the InnovAge, my former employer. So that I've parlayed that here in my practice, our LPNs, and that's who works with me right now as my right hand. We've also had EMTs come through the clinic. We're also, now working with an MA training program in town. So we actually have clinical interns and medical students from an osteopathic medical college, in Southeast the United States, at Lincoln Memorial College of Osteopathic Medicine, or the Best College of Osteopathic Medicine. We have students coming in. So I really think that it just, like I said, turned on that drive to be an educator and to teach, that, and these former scoped professionals that had sort of the typical venues of practice, to know that now they have a pathway to practice something different and something impactful and be a proceduralist before they even, before, where prior to they didn't even know that that was even possible.
Yeah, terrific. What advice would you give some of our physician colleagues who might be, I mean, unfortunately, there's a lot of this now, might be unhappy in their current clinical situation or professional situation, who are thinking about getting involved in entrepreneurship, building a business, either inside or outside of the medical arena? I just gave a talk on that at the International Vein Congress down in Miami, a couple of different methods, one within medicine, one outside of medicine. But what advice would you give our colleagues who are looking to take that leap but may not have the courage or haven't quite made the jump yet? What would you say to them?
Well, I mean, I think for me, it's a matter of having no fear, understanding that there are so many different opportunities and pathways for those that come from health careers, or just medicine, and MDs, or uh, DOs, or NDs, just anybody that's been trained in human care and science, realizing that there's value to their knowledge in industry, and leading with that. It's so interesting that, I've come to know through this expeditionary journey that I've taken, that our expertise in health and care is so needed, and to help on the industry side of things, and not being afraid to take grace and step back from clinic, because I was nervous, right? I was nervous that I had trained as a surgeon, and that I had chosen family and, a wound care, at that point, bedside skilled facility, you know employer, thinking that I would never really reach the the holistic vision of myself as a surgeon, and ultimately landed where I think I'm best served and I'm best purposed. And so my advice is just to, don't be resistant, be open to new ideas and paths that are presented to you, and realize that you do bring value to those conversations and opportunities, because you're a healthcare provider and you've touched patients and you've healed, and you can use those same tools in a different, in metamorphosis into it, or a different, venue.
Yeah, absolutely. I would love to send you that talk that I gave at Jose Almeida's meeting down in Miami. I think you would resonate with it. And I think that what you were just saying there very much echoes one of the key takeaways from the talk, which is as physicians, and especially those of us, maybe not especially, but certainly inclusive of those of us with surgical training, which is quite intensive and lengthy and requires great discipline and knowledge and study and a whole host of skills. One of the points I wanted to bring out is that we have so much that can be leveraged, and I use that word in the best possible way, leveraged
Mm-hmm.
in order to expand our scope, to be able to touch more lives, to be able to help more people, serve more people, and that the discipline that we learn, the work ethic that we learn, the sacrifices that we become accustomed to making, our ability to lead people. We lead teams as residents and chief residents and so on and so forth and fellows. And we have so many skills that are applicable to the world of entrepreneurship that we just have to see it that way, because I think
Mm-hmm.
unfortunately what we often see ourselves as is just doctors, quote unquote, just clinicians, just surgeons, and we don't see how those wonderful skills that we work so hard to acquire, and some of them come naturally to us, but how they can be used to multiply our our positive effect and help us make more and more people better through the business of better, as I like to say.
That was well stated, and great job dovetailing it into your conclusionary remarks. I
Thank
love
you.
it.
Thank
It
you
really
very much.
is. And I think the thing about it is because we have the stigma, as surgeons or just in physicians, just the atlas that we wear on our shoulders. I close my eyes and feel like doctors are that quintessential image of Atlas holding the world on their shoulders, and we have all this pressure of do no harm and benevolence, and we feel. I felt like the community at large forgot that I'm human, and that I'm not superhuman, and that I still had drive and vision to have a family and to be a woman and a wife and a mom. And so I was navigating when I was, that was 20 years ago, all of those challenges. And it was one night in 2014 that I said, why do I feel like I'm constantly pushing a stone up a mountain? And why is it always pushing back on me? And what am I doing consciously? And how can I reframe my lens and have a new vision, a new set of eyes, put on a different pair of glasses? And it's a line in one of my, I guess, in maybe my email about, it's a Proust, not, saying, a Marcel Proust saying that to see new landscapes, we essentially need to put on a new set of glasses. And I did. And that's, at that point, was that moment in my life and journey where I decided that I wasn't going to be resistant, and I was going to be open to change. And I was going to understand that it was okay to fail and fail forward and give myself grace as a surgeon, and all this expectation that had been put on me, and that I was holding on to. I said, no, this is not going to work. And that way, that was where I had reached burnout, right? And we talk about burnout all the time in medicine and physicians these days, with all of the volume of need and in providing and provisions of care that's needed, because the work is never done. Um, when I made that decision, that was when it became seemingly easier, and that path opened up, and I saw the clinic, I saw the entrepreneurship journey. And it was like the first page of the book that you're reading, that you were looking forward to reading for so long, that you never had time to pick up off of your night table to open up and start reading. And that's really, that feeling of liberation was so important. And here we are, 5 years later, or 9 years later. Time flies. And of course I still had to train and do some things, but it was to have no fear, and just leap, really.
Fantastic. Well, as we come to the conclusion of our discussion today, I have one more question for you. Maybe two, but certainly one. I'll make it the second to last. The second to last question will be, of all the advice that you've ever received from all of the great mentors that I'm sure you had, whether in medicine, surgery, or business, what's the best advice you ever received that you would like to share with our listeners?
Um, it's so funny that you asked the question, because I was just saying this to my mom yesterday, and I have to go back to this mentor and ask him to tell me the story. But the best advice that I received, it was more of a storytelling event between us. But the best advice I would say is that to realize that as doctors, we're digging ditches, and the ditch digger, despite the fact that it's a dirty job, can is it's a glorified job, because at the end of the day, the ditch digger can turn around and look at the work that they did, and understand the impact and the purpose, because ditch diggers are bringing resources to a community. I mean, you don't build a canal because to just sit there and gawk at it, or view it. You build a canal to allow ships to traverse a continent, to bring resources from one side of the world to the other. And I just, it was a very impactful statement. I don't tell it as good as the mentor did at the time he told me the story, but I think about that, and I think about, as physicians, what we do. We're digging ditches every day, and we're really bringing resources, and we're helping humanity. And that's kind of where all of the branding and all of the ideas of the business came from, is that storytelling from my mentor.
Great. And one last question to bring us to a close, and I feel especially interested in asking you this question, Dr. Kimball. If you could sit down with your 20-year-old self and give her some advice, looking back at everything you've done and been through, what advice would you give her?
The advice that I would give her is that change is real, and don't be afraid of change.
Yeah,
Don't be afraid to pivot. Don't fear it. It happens. It's inevitable, just like death and taxes.
absolutely. And I think we set ourselves up for a lot of unhappiness and anxiety and distress when we assume that things are going to carry on as they are forever. And I know that in my career as a cardiac surgeon, with the advent and innovations of interventional cardiology and angioplasty and stenting and all of these sorts of things, I was in for a rude surprise as a young surgeon in terms of what I expected my career would look like when I had set out on that path 15 years before, and how the landscape looked when I got there. And so, to your point, then you have a choice whether to kind of put up with it, lay down and die,
Mm-hmm.
throw up the white flag and quit, or like that little mouse in the maze in Spencer Johnson's great book, Who Moved My Cheese, start to explore other areas of that maze and see how you can contribute in different ways, and then hopefully be able to take care of yourself and your family in the meantime.
Yeah, and I call that the power of me. And I think that was a big deal. I watched my mentors, and I've said this in leadership papers. You're generationally taught by who is nurturing you, and your experiences in life, and the people that you meet along the journey. And that's where the yellow brick road story comes in, the Dorothy story, right, of all these people that she meets along the yellow brick road to a wizard, but that really impact you. But it's only you that can really decide what is going to stick. And so that's the power of me, and then also the power of being able to take time and give yourself grace and be okay with failing forward, because we're all perfectionists if we're going into medicine in some way. We want the ideal health of our people that we're treating, and sometimes we even make sacrifices on our own health. And I think there was a recent post on LinkedIn that said the genesis of this journey for myself is that I was dealing with my own, healing journey and not having answers and not taking care of things like I should because I was not choosing correctly. But the power of me and the power of self-actualization and being able to listen to within and silence the noise and be very selective in who your immediate five are going to be, because that's really, it's a team, it's stronger together as we go forth kind of ideal. But you have to be selective and protective of you, and that's the
Beautiful.
power of me.
Beautiful. Dr. Tracy Kimball, thank you so much for being my guest here on The Business of Better with Dr. John Chuback. And we look forward to having you on in the future again. Good luck to you, and thank you for all of your sage wisdom and your advice.